Hi, I'm Sinclair with the Power of the Patient Project. My guest today is Dr. James Granger. Dr. Granger is a pain medicine specialist in Meridia, Georgia, and has over 24 years of experience in the medical field. He graduated from Meharry Medical School of Medicine in 1997 and specializes in pain management using his philosophy, pain-free without pills. Dr. Granger mitigates his patients' pain and other medical issues using techniques such as acupuncture and hormone replacement therapy. Welcome, Dr. Granger. Thank you for joining me.
Thank you.
So, acupuncture is something that has been around for 2,500 years about. Can you explain to us what this is and how it can benefit patients?
Um, Actually, there's some controversy, so to speak, about the length of acupuncture. It may have actually been around somewhere between 3,500 and 4,000 years.
Oh, wow.
And basically, it works on principles of energy flow through the body. The body has energy channels, kind of like train tracks in a subway system. And along those train tracks in that subway system, you have points, and those are where we place the needles generally. And by opening and closing different channels and points, you can change the energy flow in the body that puts the body back in a harmonious state and allows the body to heal itself.
Wow.
That's kind of the simplified version of it. And I use it primarily for pain. Also, I have a good number of patients with anxiety and depression, and smoking cessation.
Oh, wow. That's crazy that we're still using it today and that it works.
Um, Yeah, we need to use more of it, to be quite honest with you. I will tell people no one's ever overdosed from acupuncture, but as we are speaking, people overdosing from opiates and other pharmaceutical based painkillers.
Yeah. And I know that you specialize in treating addiction, like you said, specifically opioid and narcotic usage. So, what got you into this, and what are some ways that you treat your patients?
Well, I got into acupuncture because years ago I was working a lot with chiropractors who were treating personal injury patients who had been in auto accidents, and all I was doing was prescribing medication for pain. I wasn't contributing to the healing process. So I was looking for something where I could contribute more to healing. And, I practiced Chinese martial arts, so that kind of led me to acupuncture. That seemed like a good fit, and it was. Um, at the same time, I was exposed to patients, treating them with opiates, finding a lot had more of an addiction problem than they do a pain problem. So that's how I got into also helping people with opiate dependence and using medically assisted therapy for that.
So, what kind of therapy do you use to treat them?
Well, for the medically assisted therapy, there's a medication called buprenorphine. It's commonly known as Suboxone,
Mhm.
um, which in itself is an opiate. It's a replacement therapy, kind of like methadone clinics use. The advantage of it is it's got a less complication profile. Risk of overdose is lower. You only have to take it. You only have to visit your doctor, every few weeks or once a month, compared to methadone, where you would have to go to a clinic every day.
Right.
So it's a much better medication to use.
Gotcha. And can you explain to us a little bit about what hormone replacement therapy is and how that's used?
Yeah, we have patients who come in with menopausal symptoms and male patients, what we call andropause,
Mhm.
where their testosterone levels get low. That can be due to aging, opiate use, and pharmaceutical companies have their replacement methods, but they have a lot of side effects. Um, for example, women who use Premarin can only use it for 10 years. After that, they run into a risk of having cardiovascular problems like clots and stroke. So I use a bioidentical hormone therapy, which is plant-based rather than being compounded from or manufactured from horse urine. It goes directly into the bloodstream. It's not metabolized through the liver, so you don't run into those clotting problems. It's used widely throughout the world. But here in the US, we tend to be focused on pharmaceutical manufactured solutions. In the bioidentical hormone therapy, it has a less side effect profile. The drawback is it's a little bit more invasive using the pellets, but overall, I feel it's a better method of replacing hormones.
Hmm. Yeah, I know. I agree. And finally, what inspired you to get into alternative medicine? Why are you so passionate about living pain free without pills?
Um, it's kind of two questions in one. That's good. Um, Alternative medicine, I really can't say what spurned it. It was just, one day in the hospital looking at all the IV poles and machines and stuff, it just kind of dawned on me there has to be another way to do this. So I started looking at other things, herbal medicine, chiropractic, acupuncture. Um, so I try to use the least amount of pharmaceuticals as possible, which kind of goes along with the next thing, pain free without pills. As I said earlier, acupuncture, you don't have people overdosing. It's been around for thousands of years. It's a much safer method of pain control. Now, are there patients who will need opiates and just can't get enough pain relief with acupuncture? Of course, but I was taught in medical school you use the least invasive, safest thing first. So I think that should be, alternative preventative things should be at the front line and save the surgery and strong pharmaceuticals for the back end. Here in the US, we tend to do the reverse. Um, and that's a money and politics issue that we can probably leave for another day because that's a whole long discussion there.
Yeah, I can imagine. Well, that's all the questions that I have for you today. Thank you so much for joining me and providing our viewers such great information about acupuncture and hormone replacement therapy and just everything that you do.
Oh, thank you for having me.
Of course.